we're both from a diverse background.
Yeah.
Both have Indian heritage. So has that impacted you in any way, or what, there must be some benefits there as well to being
Definitely.
from a diverse, lots of benefits.
Yeah.
What's your experiences been like?
I think a lot of the time, even throughout placement or during my time at university, there have been advantages in terms of service users or patients that I've seen. So, for example, the whole language barrier. I can speak Hindi and Punjabi fluently, so conversing, communicating, understanding the patient or service user, that's been really, really helpful as well. And it kind of helps that you know where they're coming from, because a lot of the time you feel that you're sort of wondering, oh, hang on, why can't you have a male carer? Or why do you have to wash certain many times a day? Or it's just little nuances like that. You kind of understand where they're coming from, because your family would probably say the same thing. So it's it's that understanding, and I feel like I've used that to my advantage. I've recently started getting a lot of more of a diverse caseload actually, so it's been really useful to have my heritage, and obviously the communication barrier as well. So it has worked to my advantage.
No, it's true, because you start at a different level, don't you?
Yeah.
You don't have to understand certain things. You might ask questions to confirm bits. But it does mean that you can go out there and do your assessment and do it quite confidently. Knowing some of the background already in terms of the culture and the way in which people live. And there's the language barrier. I kind of found, and I experienced all of those things. And I was allocated those cases because I was able to speak Punjabi like you do. And and it kind of all made sense. But what I found is, and I'm a different generation to you, and I don't know if you've had the same experience, but when I went out, so everyone when I was growing up, regardless of whether or not they were related to you as an uncle or an auntie, do you know what I mean? So I used to have to go in and I just couldn't bring myself to call anyone by their first names or call them Mrs. or something like that, because they would just give me, they'd give me really funny looks if I did any of that, and they responded better to being called auntie or uncle, because that's how I grew up. And I mean, what I did find is, though, that when I went in, that you learned a lot about who they were as a family, because they would ask you, like, so I was asked, what, from in India, what village is your family from, and where's your in-laws, and on all the rest of it. I was this far from getting arranged marriage to one of a son. And I had to tell them, no, I'm already married. And then I got told off for not wearing earrings, because if you're married, why aren't you wearing earrings? Because it's the thing, isn't it? It's wearing the bangles and the earrings. So lots of really, really quite funny situations as well. But it's all part and parcel, isn't it? It's all part and parcel of understanding all of those things.
Definitely. And then as soon as I say uncle or auntie, I feel like, oh, hang on a minute, should I be saying that? I should be probably more professional. I should be calling them by their surname. But sometimes it just comes out. There are certain service users who I feel like I can say that to, but then there are also some that I feel like I need to maintain that, that sort of barrier.
You say auntie and uncle as well?
I do. I say it to everyone. It's actually a sickness. I need to I feel like I need to stop, because there should be barriers, but I say it to everyone, like, because even my dad's friends, anyone, you feel like there's some sort of respect. But it comes out naturally. But I've had to sort of stop myself, like take a step back and say I can't say that actually. We need to maintain professionalism. But there are certain people who I still say it to.
That's a difficult one. I found that a difficult one.
I didn't want to go and tell Ali in supervision that I've got to that level of comfort.
I don't think it's a level of comfort though, is it? It's kind of like it's your own upbringing, and in terms of the Indian culture, there's a lot of you need to respect your elders, and it's drummed into you, isn't it, at a very early age. And there's a huge value placed on your elders, and the wisdom they that comes with that. Definitely. Being elders. So I don't know if that's having so many years now in the profession. I don't think that's wrong. I don't think it's wrong at all, or it's not professional. It's using yourself, isn't it?
Yeah, definitely.
Almost the therapeutic use of self.
Yeah.
In terms of trying to get the best out of your interaction with someone.
Yeah, definitely. And I feel like you can sort of play off with the fact that a lot of people from diverse backgrounds, they place a lot of importance on extended family. So you sort of it's just not just, you're obviously considering the carers, you're considering their family, and you take all of those beliefs and values as well as the service users, so you can sort of see where everyone comes from, because they're all still with the same beliefs. So
So have you experienced any barriers at all?
On a few occasions, I'll have to say it's not common, which is good, but there have been some service users who may not have taken to me very kindly. I've heard some name calling. That was back on placement. Like when I joined HCC in September. Since then, I haven't, touch wood, experienced any negative experiences in terms of going out or doing my assessments. I've had issues with family sometimes, but not the service user per se. But it's just something you sort of brush off. Unfortunately, it is something that you just sort of have to deal with. But I just brush it off.
And it's sad, isn't it? Because we're so used to just brushing it off and just almost accepting that that's just the way it is. And that's, I think, it's the sad part. I mean, the few instances that I would have when I went out, when I was frontline and going out, was as soon as somebody would see that you were you're Indian, you're from a different background, people would speak slowly to me because they weren't sure if I could speak English properly. So I had that. I think that was probably one of the most one of the most common ones. They'd speak slowly, and also if you say you were going out with one of your colleagues who just happened to be a junior member of staff, it was always assumed that they were the OT and not you.
Okay.
So I had that a few times. Where not that often though, but that's changed. It really has changed over the years. Thankfully.
Thankfully it has. Even in university, we had quite a diverse cohort, and we were lucky enough to learn from each other. On placement, I'd have to say that it wasn't as diverse as I thought. I think HCC and one of my original placements in health, those were the only two placements where I thought it was quite diverse. But I think it depends on where you go, obviously what location it is and what setting you're in as well. All that comes into effect. But it's apart from the name calling, I don't think I've had any other issues in that sense. I've had a few times where obviously people know that I think for a while Ali was handling WellHat on her own. So when I came in, a lot of people were very familiar with Ali. So I've got a lot of, where's she gone? Like you're not the OT. Surely you can't. Or they remember me from when I used to go out with her on placement. And I don't think it would be a diversity thing, but they're probably thinking, is she a OT now? What is she doing here? But it's just.
I mean, in terms of Hertfordshire and working for Hertfordshire, I've not experienced. I don't think I've ever experienced racism at work, or or it being, maybe if it was obvious, I would have, I'd be able to pick up on it. And I think because you go, you building your own little coping mechanisms, don't you? And you kind of, you work out really what's worth the fight and what just isn't. Definitely. And what it's just, and it's just not worth it, because you just think, well, that's your problem, not mine. Kind of thing, but no, I've always been, really well supported in Hertfordshire, and have had great managers who have, really pushed me and wanted to see me do well. So, I'm really thankful for that. I think I owe quite a bit to Hertfordshire, actually.
I feel the same way. I feel very well. It's only been a year, but I feel very well supported. Even John's been very supportive. You always think that sometimes team managers are out of your reach. Like maybe like you can't approach them that much, but even like if we were in the office, that he's right there. You can just go to him, ask him a question, or if you wanted to chat, he'd always, even if he was busy, he'd just say, just come back an hour later, but he'd always be there to have a chat with. And even now he like calls up just to check if we're okay. So it's really good to have a supportive team manager.
And does it make a difference? Because I know, John's also from a diverse background. Do you think that makes a difference?
I think it does. We had a good chat actually after all the events in the US, I think, when they first happened. Because obviously we discussed it during the team meeting, and there were quite a few peer groups based on those events as well. So it's good to hear his point of view, because sometimes you feel like it's not they don't put a mask on, but they have to maintain a certain level. Like, oh, I'm the manager, I'm here to sort of make sure that everyone else is okay, but then you don't never who's going to check on them, sort of thing. Like, we don't know if they're okay. So it's really nice to just sort of let your guard down, and everyone's on the same level, and we can all just express how we really feel, and how things need to change in the future. So it was nice to talk to him about that kind of stuff, because we never sort of hear that from him. But it was we're very appreciative that he did feel like he was comfortable enough to let his guard down in front of us.
And you're absolutely right. As a manager, you would you'd kind of present in a certain way. But this was one of those occasions where we've all had to kind of let our guard down, and regardless of how we might feel personally, because I have to admit, I did find it difficult. There's no doubt that John must have found it difficult as well to talk about it. But when you hold positions, and certain roles, I think you owe it to your to your own staff group in terms of support, to ensure that you are you're there for them and you're willing to listen.
Definitely. I feel like after he spoke, definitely. After he spoke, I think everyone in the team started talking, because there was like an awkward silence, especially how it is on Teams as well. It makes it even worse. So after he spoke, there was a bit of an awkward silence, but because he did, other people started speaking up, whereas before I don't think anyone would have come forward. So it was a really good thing that he did, actually, because it got everyone talking. No,
I would agree. No, it's good. It's good.